My name is Tina Joyce, and I'm with the Institute of Leadership in the RCSI. This webinar is a collaboration between the RCSI and the Quality and Patient Safety Directorate in the RCSI Hospitals Group. I'm joined today by my colleague Dermot O'Flynn. Dermot is the Programme Director for the Professional Diploma in Clinical Leadership here in the RCSI. And Dermot is now going to interview our 3 clinical leaders. Dermot, over to you.
You're very welcome to what I call these lessons from the front line. I'm joined this morning from the team from Connolly Hospital, from Judy McEntee, our Director of Nursing, Trevor Duffy, Consultant Physician, and Ms Brenda Minch, Clinical Nurse Manager too. There's been a lot taught about clinical leadership over the last, really since the COVID started, and from a clinical leadership perspective, what have you learned from the COVID crisis that will help you and your team of really hard-working physicians in the future?
I think, in part reflecting on it, there's been a sense of a return to basics. And we're dealing with a disease that was quite unknown, very limited treatment interventions. The workload and how it was going to turn out was very much unknown. And as a result of that, we all just had to knuckle down and pull together. And I think that kind of sense of interdependence, and particularly what I particularly enjoyed was the reconnecting, in a sense, the junior doctors. A lot of that over years has become very formulaic and following neat, what would you say, usefully constructed training programs, but we've lost some of the basic day-to-day interaction. So I think that has been something, once I've learned it, we've rediscovered the need for that just basic day-to-day interaction.
Okay, and is there, from your experience, is there going to be a time in the day when that can happen, or will it just happen naturally in the future, those interactions?
That's the problem. I think as we revert back to normal, so to speak, and normal in an environment where I think interactions are going to have to be even more constructed, given social distancing, given the limited facilities. I think it's going to be very difficult to protect that natural interaction. For example, again, my specialty is an outpatient bed specialty, and we'll be going to a structure where you'll have 1 patient in a clinic room per hour. The ability to drop in and out of rooms, have a bit of a joke with the juniors and teach at the same time. I mean, it's going to become increasingly difficult. So, but I think what we have learned from this 2 months or this 3 months is that it's vitally important, and I think we perhaps lost some of the sense of importance of it.
Okay, well, thank you so much. And as nursing director, then, Judy, from your point of view, what surprised you over the last 3 months regarding your team and the people who work with you?
Well, I suppose I've always known that we've got a really great team here in Connolly Hospital. I suppose what pleasantly surprised me was the adaptability and the real readiness to adapt to the changes that were really coming hard and fast at us. And I suppose usually, you know, we're used to working within a structured, you know, in a structured way. In general, staff know where they're going to turn up and work on a day-to-day basis, a year-to-year basis. But during COVID, we really relied on people moving to work in different areas that perhaps they've never practiced in before. And I suppose I was quite nervous initially that, how would that pan out? How would people respond to that? Because normally when we're making changes like that, we do have time to make those changes. And I must say, the way in which staff did respond and really rise to that challenge, and although there was anxieties and nervousness, people really got on and did what they needed to do, and that was really from an interdisciplinary perspective. I echo what Trevor had said earlier. There was a real camaraderie and a real come-togetherness, and that whole concept. And I know as a nation we use that we're in it together, but that was really visible here in Connolly Hospital.
And I'm just curious. Then we've had other crises in the past, and we haven't had the same reaction. So from your years of experience, how can we actually capture that now and apply it to our trolley crisis next year, etc.?
You know, you're absolutely right. Like we've in the last few years, I've been director of nursing here for 5 years now, and I suppose we have had a number of crises in recent years in relation to, you know, storm Ophelia, the bad
Yeah,
weather, and the snow
yeah,
a couple of years back. You know, industrial action. You know, in the previous years. And you are right. I think this has been very different because it has impacted on everybody
everyone.
nationally. So
Yeah,
it doesn't matter what, you know, where you work, where you live, what you're employed as. So I think that's why this is fairly unique. I think, you know, by participating in sessions like this, we'll hold on to perhaps some of the learning and you know, keep it in our minds. But I think that'll be a challenge too, because I think we
yeah.
quickly, and even now we're quickly coming into a new normal, and so, you know, there is a big risk that we might lose some of this learning.
So I suppose the concern is don't revert to type. Keep moving forward in what we've learned. Thank you so much. Rita, I'm really interested when you talk about your years of experience, but how do you implement rapid change, you know, into the health service? Because that's something we're not very good at normally. So what have you, on the cold face, what have you done over the last 2 months?
I suppose from my side, and it might sound strange when I say it, but this was new. So we had nothing to compare with before. So we were writing our own book when this started.
Okay.
So you had all your colleagues, your friends, infection control coming with you on board, and you moved forward as a team together. Before this, as I said, when we had crisis, this was so significant, and we were tracking it from China to Italy, and we were seeing the pictures. So we knew, we hoped it wasn't coming, but it did come.
Yeah.
And I think when you're doing something first, and I was so lucky to be the first ward to start this, everybody was with us together as a team. And we made mistakes today, but we learned from them tomorrow. And the staff learned, and you came into work the next day, and your colleagues and my colleagues and the staff nurses, healthcares would have questions for me. If I didn't have the answers, I got them for them, and I came back to them. So from that perspective, I found it was a learning curve for everybody.
Yeah, not easy. And tell me, going back to your, maybe say your boss for a second here, when it comes to what was the most difficult thing as a leader then, if you look at it in your case, Judy, leading this team of people, what was the most difficult thing for you?
I suppose there was great anxieties about safety and personal welfare. So one of the key elements for me was making sure that the staff trusted that we wanted to keep them as safe as possible, and that we wanted to make sure they were protected with adequate PPE, with, you know, maintaining social distancing, you know, and we really did. We created an environment where we had forums to listen to staff. So we did create a safety huddle every morning. So we met at 10 o'clock, and things did come up at that huddle that, you know, helped me then to make decisions and find a way forward. So simple things, you know, we incorporated scrubs into our uniform policy, so that staff could come and change and then, you know, have their uniform laundered and go home, you know, without having to worry of that. We really did work very, very hard to make sure that we had adequate PPE, and it's something that as a hospital we're very proud of. It did take a lot of you know, a lot of work, and we were really supported operationally from that perspective.
Great.
Also, you know, we, as I said, the staff had to be very mobile, and the redeployment of staff was absolutely colossal. And we had nurses who moved from endoscopy departments, outpatient departments, theatre departments, and wards to staff our critical care. Our critical care capacity at one stage quadrupled. We don't have a high dependency unit normally in the hospital. We opened a high dependency unit. We really responded. So my concern there was, how do staff, how are they supported? how are they acknowledged, how are they taught. Education became, we had to respond in a real timely fashion
Yeah.
to educating and supporting staff.
Okay.
So
A lot.
Yeah.
So Trevor, going back to you, one of the concerns we had even before the COVID crisis is that the burnout level of clinicians. So what coping skills were you able to use during the last couple of months that have helped you and might be worth sharing with your colleagues?
I suppose again, it was really down to just personal interaction. And from a work point of view, just to reflect on something Breda said a minute ago, I think that the newness of this actually led to a kind of a sense that there was a bit of space for forgiveness, that you could make mistakes. Everyone was doing something new, and that I think makes it an awful lot easier to cope. I think the burnout, a lot of the burnout comes perhaps from a self-perceived or perhaps from an institutional sense that you can't get anything wrong. If you raise a hand, you've always got to have the answer. But there was definitely a sense of a little bit of space here to make mistakes and learn along, and that was incredibly useful. So I think it's really just relying on the people around you and being honest and interacting.
Okay, very good. And Breda, going back to you, what techniques have you managed for yourself in your own downtime to switch off and relax?
Definitely the sun, as you can see.
You see, well done.
Yeah.
We're so lucky that we have sun.
Yeah. The garden, I've very good family support. But also my colleagues here, even between phone calls, when we first opened, we opened up on the 22nd of March, which was a Sunday, and I came back to work on the Monday. So my colleagues here supported me. There was phone calls, there was emails, even coming in, working with Trevor in the morning, and we'd start off a dry round, and the support I had for the doctors on the ward was amazing. We worked so much as part of a team together, like we did the rounds together. And there was great feedback and connection with us. And then, just outside the air, that was one thing I found, because with the COVID, the windows were closed, and it was everything. All I used to do was get into the car, windows down, and then when I was at home, the back door was wide open. I never appreciated air so much when I used to leave the hospital to get out.
And it is free, which is wonderful still, but we're not charged for air yet. And it's interesting to say that, because I would find that even hard at home. You're not going out regularly enough to get out of the house and go for a walk on the block and back and do some more work. I think it's really important to get out. That fresh air is key. Going back then to Judy, what are your coping skills? Because you've got a huge agenda over the last months. For you, how have you coped? What have you done differently?
Well, I suppose, again, being experienced as a healthcare professional, I don't, experience, has stood to me. I suppose over the years I've learned how to become resilient, and I suppose understanding myself, being very self-aware, and being, just being mindful of how I react, and how I would react to certain situations. I must say I've got a fabulous team around me, and like Breda says, there's always somebody to go to have a little bit of a debrief, or to say I'm not sure about this, or I'm not sure about that. And then the basics, it's, minding oneself. So important to, there were times when we were here like 7 days a week, but in those 7 days it was about, making sure that we did, eat properly, that I, slept, just the basics, a little bit of exercise. I suppose, like Breda says as well, I'm very lucky to have great family support.
Good.
And I suppose taking time out, and I did turn off the radio and the TV, and I did dance around the kitchen and listen to,
well done,
to mad music and all that sort of thing. But it is just about, doing the... But
it's interesting that the dancing around the kitchen energizes you.
Absolutely.
It gives you energy. It looks mad, looks crazy. I'm not a great dancer myself. My wife will say that. But it's really important that whatever works for you to energize yourself. That's really important.
I suppose the other thing that I would say as well is, again, over the years, and this is something that I've learned, I think, is the power of positivity.
Mm.
I would have been in the past a real worrier and thought, oh my gosh, what are we going to do? And this is awful. And I've turned that really on its head to say that this has been such a wonderful learning opportunity.
Yeah.
And there has been, silver, there's been clouds of, silver clouds in the lining, of, what's that expression? I don't know the expression. Every cloud has a
silver lining.
Yeah. So, it has been a great opportunity as well, and I go back to what Trevor was saying, that it has maybe refocused us on the real importance of teamwork, the real importance of communication, and given us time, to have that communication. Alluded to the 10 o'clock huddle that we have every morning. I had time for that. It now takes 10 minutes, but my gosh, I think we're way more insightful as an organisation as to what our priorities are for today. So I think that's really helpful.
Great, thank you for that. My colleague Tina Joyce keeps on saying, when I join her sometimes in the classroom to teach, that one of the key skills of a clinical leader is their ability to influence. And I imagine each one of you had to use your influencing skills at some stage over the last couple of months to get something that you never had before. So maybe I'll start off with you, Trevor, first of all. Where did you have to use your influencing skills to get things done on behalf of your patients?
God, I'd have to say contrary. I think it was probably one of the easiest times I've ever had to get things. Everyone was ready, willing, and able. It was amazing. I suppose one of the things though that strikes me, and again, it's hard to see how you fit it into the busyness of normal day-to-day routine, but that old comment that you don't ask somebody to do something you're not prepared to do yourself. I think that was really important. Again, given the unknown of all of this, I think it's seeing people on the wards like Breda and all the way through, that if there was something to be done, there was no question of trying to offload it to somebody else. It's just go and do it. And including kind of walking into the room, putting on the PPE, and when other people around you see you doing it, they're more confident, and it grows over time. But yeah, I think which is one of the enjoyable parts of the past 4 months, because the health service is normally full of games and all sorts of strategizing, to put the right word in it, but there's very little of that.
Brilliant. So actually what you're saying to me there is that actually the impact of what happened broke down off all those barriers where you didn't have to spend a lot of time influencing people. They just said, yes, what you want.
Yeah.
Brilliant. Okay. Did you have the same experience, Breda, when it came to having to use your influencing skills?
Yeah, I think, as I said, because I was the first ward to open, I had great, even I was thinking today, even the guys in the stores department, pharmacy, equipment, and you rang looking for something, or even somebody to put you on the right pathway to get it. There was somebody there to help you. And then what we found was, because again the fear was there, that we didn't want to leave the ward, so we had an issue there about getting food and water and even little things like that, and even just asked the catering manager, and we got sandwiches sent down and bottles of water, and something so simple. But when you're putting on all the PPE and the staff are coming out, at least they had some food and resources there in the evening, and everybody, just whatever I wanted, it was phenomenal in this hospital, the support, and then that was led out then to other areas afterwards, and the other wards then learned from what I had started in the beginning. So yeah, I think it's just great when you've worked in the hospital for so long and you know people, and there's a great nursing framework here. It worked really special.
Yeah, and I think that's fantastic to hear, because often you hear the opposite, that you have to battle and fight for things. So again, there's this team focus on a key goal we all have to deliver on, and the support is there for you. From the nursing director's point of view, did you have to do any influencing, or did the people just jump on board saying, the CEO says yes, what do you want?
My technique in influencing has always been to remember that the patient is at the centre. So usually when when you've got a solid and a sound reason and a rationale for wanting something done, you can usually get it over the line. I suppose it's becoming more complicated as time goes on now, because I suppose we're trying to revert back to this new normal. And there's a lot of things that we need to do to still reconfigure services and all the rest of it. So I suppose it's quite simple when you're doing one thing, but when there's several things in the pot, then that becomes more challenging. But I think just remembering always about the patient and the service user, and it usually helps in getting the right solution to the problem.
Yeah. Okay. And tell me, Trevor, going back to you, what was a light bulb moment for you during all of this?
Might have reflected. I can remember one morning, kind of after a round, I think, calling into the ward, maybe an hour after a round, and into the junior doctor's office, where they were doing their best to social distance in a small space. But again, to see a whole team there interacting with a kind of a shared purpose, I think that struck me. Again, I think a couple of moments where my Breda and myself had good interaction on the ward, and just kind of a couple of times you go home and you kind of reflect, that's the way it should be. Just discussing patients over the kind of a dry round in the evening before you go, and say that just makes work and easy, and it makes everything kind of hum, so to speak. But it was a lot of subtle little events rather than a light bulb moment.
One light bulb. Okay, thank you.
Yeah.
Thank you for that. And Breda, when it comes to service improvement now, do you see yourself implementing anything you actually used during the COVID crisis? Things you've learned and done that you want to implement into normal standard operating procedures?
I suppose one of the things I would have done on the ward was like put the next of kin numbers on the handout sheets, because we had a lot of deaths. Like one day we had 3 deaths one day, and rather than going for nursing notes or losing track by answering a phone, we've started actually, I put the next of kin numbers on the handout sheet. And I think going forward, I think it's maybe us ringing the family now and us communicating with the family better as a nursing team, rather than maybe the families ringing in. Might only be like a minute or 2 minutes of a phone call, but I think they're so vulnerable. The patients were vulnerable, but the relatives were as well. So much. I think now, for my role as a manager, I think even if it is somebody, the patient is in that bed, and even that phone call in the morning to somebody to say, look, your mum, your dad, your brother, your sister had a good night. They maybe might want something brought in, but just open the communication more to families, rather than waiting for that phone call to come in the morning, and they're probably sitting at home in normal circumstances, worried. And then I think definitely working with Trevor and having the team there, there was really cohesive work between us all. The communication was fantastic. Going forward, I'd like to continue that connection.
So you'd insist that that ward round with Trevor and the team happens with everybody who should be there. Always.
Well, hopefully he's going to stay with me now 24/7.
I've been on both sides. I've been the patient, and I've also been the patient family. And you feel when you ring, it's not the right time to ring because you're all so busy. But actually make that call and make that link that it is a real, as my father used to say, it's a real human being in the bed, with feelings just like your own. And a complication like you, and the family outside. I really love that. So hopefully you can build that in for the future. That's wonderful. Going back to Judy, then, when you look at overall of the service, is there a service improvement that you see as key for the success going forward? There's something in your list there.
Well, I think we've learned a lot about technology and using technology in caring and seeing, caring and treating our patients, I suppose. So I know that we've used lots of different techniques. Breda talks about our interaction there with families, and we really heavily relied on things like video links like FaceTime with patients and their families. And I suppose one of the really difficult things for all of us, and that goes against the grain of nursing, is that families couldn't visit, and there still are visiting restrictions. That's very, very challenging. So we did utilise IT to support us in that aspect. We also used IT support for virtual clinics, and I suppose going forward, we will continue to do that. And then one of the big challenges from a nursing perspective was obviously nursing and healthcare assistants here make up to half of our workforce, and we really needed to keep track of where everybody was, and it's a very manual system at the moment. So one of the things that I will be really seeking to have going forward is an IT-based system for rostering.
How can we now, with our teams, not go back to the old way of working? How can we now take the learning we've taken from this crisis and make sure we embed it into the future of our successful healthcare teams? So everyone's picking them up first, saying, "Well, what are you going to do to ensure we don't go back?" Really,
we had areas there. We had an awful lot of patients that died.
yes.
We're in the process of doing memory boxes now, and
Yeah.
I've said that we'll meet with the families, the next of kin. We'd meet with them and whatever staff member they connected with. And I think going forward, because the empathy came back into nursing, the caring came back, the time, staff were using their mobile phones initially to make phone calls for these patients. And I think even I've all the names of the people that have passed away, and I think going back or going forward to be able to say to the staff, we did so well during this period, continue doing well, and we worked together so much as a team. It's like as if we're all watching out for each other's back now, and we're minded an awful lot more closer than what we were. And I think just remembering those people that did pass away with us, and even like there's still cards coming in now saying thank you, and we'll all come around and we'll take them out and we'll remember. And I think there's just that specialness, uniqueness that we've had that I hope is nursing that will bring us back. And even I have a fourth-year intern nurse who actually cancelled her first week holidays to come and work with us because she knew we needed us. Her last day now is on Sunday with us, but she had said to me there last week she's learned so much, and she's from nursing with her has really brought back her profession, her faith, and her connection.
Well done. Is that very encouraging? And Trevor, from your point of view, you mentioned earlier on about the maybe not being as close in contact with the trainees and the junior doctors and all the rest. So when you look forward, what will you take forward with you to improve the situation for the future?
I think we've just got to make sure it's on the agenda as a valid, important component of the day. Because as Brenda said there, and it's interesting to listen to the way she said it, I think we've always understood that caring, be it for the patients, be it for the trainees, be it for whomever, is an intrinsic part of what we do. And I think we've understood that things like measurement and targets are important when they're used to that end. But over recent years, that it's become a measurement for measurement's sake. It's the easy thing to present on Joe Duffy. It's the easy thing for external interested parties to focus on. I think we've got to try and get to a situation where we put it all back in perspective, and the end goal really is the caring goal, and everything should serve that, not the other way around. And that's a lot easier to say than to do, though, when you have a multifaceted, underfunded, complex service.
Yeah, and you're absolutely right, and it is very challenging, and it's I suppose it reminds me of years ago, somebody said, well, we work within your circle of influence and work out gently. So you get the piece you can do right first, and you move out. And for all of you, it's going to be a challenge, but it'll be a very rewarding challenge. You've seen the benefits of what you've done the last couple of months. Can I come back then to Judy on this question? From your point of view, how can you avoid going back to the old practices?
Look, I think it's building on where we've come from, and one thing that I would say is I pride ourselves within the Department of Nursing for having lots of regular contact. We've been from as a director of nursing, I would meet with the wider team every 2 weeks. And we have, what we call a Friday forum, and I would meet with our clinical nurse managers, and we have, a system where we look back on the 2 weeks prior and see what's been good, what's not been so good, and what's our way forward. And I think that during COVID, the huddle that I've described all through the interview this morning, that has been a multidisciplinary way of doing something similar that we've been doing in nursing and for some time now. And I think that has been, for me, really, really powerful, because you do get to hear in real time what's good, what's bad, and what we need to do differently. And I think that if there is a common goal in the organisation, so in healthcare as a nation, we've got a common goal in promoting health and making a difference. So obviously within each organisation, that goal should be really clearly understood by everybody who works there. And I think that the issues that come up in health are very often because people don't really appreciate what's going on one ward to another ward, or what's going on in one department from another department. And I think the secret with this has been that everybody, trust has really built. Trust has really built that, even though we're having to make difficult decisions, it is done, with the best intention in mind. So I think that would be a massive learning, for me, and it's
great.
that definitely.
I'm just going to say I'm humbled talking to three this morning, talking to three people who've delivered a service and quality care to patients, outstanding, and people who've learned so much from the experience as well, and that you're willing to share that experience with your colleagues in the RCSI Hospital group. For me, some of the key messages that I take away from today, which ties up quite a lot of the stuff we talk about in the literature as well, is the whole key, that clinical team and the success of the team. It's not my idea or your idea, it's the best idea. And that whole concept of the huddle, the team comes into the huddle to communicate both the good and the bad, is key. The adaptability of people in a crisis, and particularly I think in the healthcare crisis, because people are dealing with people's lives. We're not dealing with people's machines, we're dealing with people's lives, and be able to adapt and do our very best to actually improve the quality of care of those people as best as we can. I think the mistakes have happened along the way, but we've all learned from those mistakes, and we share those errors we made along the way. That's very, very important. And there's a key word called trust, that you won't talk about trust, is in trusting yourself and trusting your colleagues to actually deliver the quality of care. And also trusting other departments, right? So you're no longer stuck in your functional silos where I'm in stores and you're in nursing. We're working together. Occasionally working with stores are working with nursing, etc. It's now, you're not waiting for hours to get the service you require. It's about ensuring the support is there for our staff, in that when we do require, when people have gone through a bad day, they may have lost a patient, they need to sit down, the support is there for them, both internally and externally if required. And that keyword resilience, I think you all showed that in spades, that we have to develop a resilience to deal in these situations. And I think for the future, it looks very positive. If you can take the learning from what's happened and apply that day to day. And so my challenge to you is that I would love to come and spend a day in the life with you in maybe 6 months' time. I do this quite regularly, but it's not, I do this with Sarah. I work alongside you. Obviously, I won't get involved clinically, but I just watch and observe and see if you're willing for that challenge. To see, because I learned so much myself from going back to the shop floor, as they say. So Tina, I suppose just to wrap up, thank you all so much. It's been an enlightening conversation. Thank you for sharing your time with us. If you are off this weekend, have a lovely weekend. If you're not, then be safe if you're working. I think when you're on for the weekend, now you have that suntan, you're on for the whole weekend now. No more sun for you. And have a nice weekend. Thank you so much.
Yeah, I'd like to say thank you as well. It's been really, really heartwarming to listen to the stories this morning. And very, as Dermot has said, very humbling. And so many things that have just stood out for me. I loved the idea of the memory boxes and just keeping that connection going between families and the people who've passed away and the staff and what that can do. And this idea that Trevor spoke about the connections that were always there, but they've just reignited, and the empathy that is coming through as well. So if we're looking at it from a leadership perspective and wondering what lens we want to apply to this, what we're seeing here is a really live example of compassionate leadership, lots of empathy, lots of listening and understanding each other, and collective leadership where everybody has a single goal and a single task that they want to get done, and finding ways to do that. So again, I just want to thank you for sharing that with us this morning. It has been so helpful and really rewarding to listen, and thank you for everything that you're doing on our behalf.